Hi everybody, this is Dr. Mary Gardner with Lap of Love, and today I've got a co-host with me, Norin. He decided to be a part of my Facebook Live, and he's actually a new family member that we rescued a few months ago, and he's a 3-year-old pointer, so he may come in and out of this video, so we'll see what happens. But this episode is going to be talking about incontinence in geriatric dogs. So I know that sometimes our cats can be incontinent and our younger dogs can be incontinent, but I wanted to really focus on the incontinence of the geriatric dogs that we see. So as I mentioned, puppies can be, incontinent because they're just puppies and they're not trained yet or housebroken. Sometimes new dogs in the house can be having trouble understanding the rules of the crib. But once they get older, they typically already understand the rules. They've got their daily habits down pat. They know that they can hold it for 6 or 8 hours. But we start to see incontinence in older dogs, typically 10 years or older. And I wanted to talk about that today. So we have to make sure that we understand the difference between urinary incontinence and just inappropriate urination. So with inappropriate urination, the pet knows that they need to go to the bathroom, but they still have an accident in the house or maybe on the porch or the patio and not where they should be going, right? And so they're aware of it, whereas urinary incontinence that they're unaware of is what I want to focus on today. And that's basically that they have no voluntary control over this passage of urine. So they just don't even know about it. They can't even control it. We typically see this when they're sleeping. So whether your dog dribbles just a little bit or maybe actually has a very large urine output in the middle of the night, just for some reason they just don't even know that it's happening, and you wake up or they wake up and they've got a little bit of wetting on their bed. Now, this video is supposed to be for both fecal and urinary incontinence, so don't forget about the fecal incontinence, but I'll get to that later on. So urinary incontinence, though, we see a lot, and it's a little bit harder to manage, right? So fecal incontinence is pretty much easier to clean, but urinary incontinence sometimes can be in the most difficult of places, usually where you step and with your socks on. But anyway, so with urinary incontinence, the pet usually doesn't even know that they've leaked or had a full expression of their bladder, and typically we see this at night or when they're sleeping or they might be on the couch. So there's a few reasons for this. For urinary incontinence, one reason may be just a neurological disorder. So typically maybe a disc disease that they might have, or even trauma that they might have experienced for whatever reason. But with these older guys, a lot of times they'll have disc disease, and so this will cause neurological issues, and the sphincters of the bladder can get affected. So the nerves that innervate the sphincters can get affected. So that's one reason. Another reason is a hormonal response. We see this typically in older female dogs, where they just have an incontinence as they got older. And then there's also diseases that makes a pet drink a lot more, so that way their bladder is more full, and when they're sleeping they just don't even realize to wake up, or they are having inappropriate urination around the house that they're aware of, but they just can't hold it because they're drinking so much more. So some of the causes for this could be a urinary tract infection, and to be honest, with an older dog, I pray for that one. So because that one is easily treatable. A lot of times we'll see that if they're licking licking their fur, or they've got a lot of skin infection or something like that. When they're older, we see this more commonly, that a urinary tract infection may occur. Some other diseases that we see in older pets that make them drink more is diabetes. And it's not just, a chubby dog or a chubby cat. A lot of times there's the other type of diabetes that they can get. And so diabetes, of course, our dogs and cats can get, and they will drink a lot more. Another very common disease in older dogs is Cushing's. I had 2 of my dogs had Cushing's. So my first Doberman had Cushing's, and then my Samoyed had Cushing's. My Samoyed also had diabetes, so I had 2 diseases that made her drink a ton of water, and therefore she could not hold it in the house for maybe every 30 minutes she had to go to the bathroom. So her incontinence got really severe. Another thing that I forgot to mention is that sometimes they just don't know, and oftentimes, especially dogs over the age of 10 will have some form of cognitive dysfunction, which I think I did a Facebook Live video on this before, where they just don't know that they're going to the bathroom. And so that's something that I want to let you know, is to not get frustrated with them. I understand if you get frustrated, but definitely no punishment. So again, we could have neurological dysfunction, we could have a urinary tract disease, we could have some other diseases that we just want to rule out to see what is the cause of this. So that's with urinary incontinence, and fecal incontinence is similar with the neurological problems. So whether trauma or Edward, your little Sophie had Cushing's, so I'm with you on how difficult that could be to manage. But the fecal incontinence we see a lot with just spinal disorders. So like I was talking about earlier with the disc disease, because nerves come out of the spinal cord towards the rear end of the pet, and they innervate the sphincters, so the anal sphincter, and literally the pet does not even know that they've got feces. And so sometimes not only when they're sleeping, it will just come out, and Edward, drinking, filling up the water bowls is the problem. But with the fecal incontinence, we see this when there's increased abdominal pressure. So when a dog coughs, or when a dog is just getting up from a laying down position, sometimes a fecal ball will pop out, or they're just walking along and they just start to have some incontinence. Hi, Heather. Anyway, so both urinary and fecal incontinence is definitely a challenge, and I get it, because I've had more with the urinary incontinence with my dogs as they got older, so I understand how difficult that can be. So the first thing I want to do is suggest actually going to see your veterinarian, because I know that sometimes there's it's difficult to bring these guys into the car and into your clinic, but it is such a benefit to bring them into the clinic, because we could do some testing to make sure that they don't have diabetes or Cushing's, and if they do, how can we manage that? We could also, or your veterinarian can also do a good physical exam and check for pain along the spine. We are really good at noticing the subtle signs of pain that you may not even recognize. Even taking an x-ray just to make sure that everything is good with the spine. And while we're taking an x-ray, we would also look at the bladder too, because sometimes actually a tumor could be in the bladder that's making the bladder space too small for urine, if you will, and so that way they have to pee, they have to urinate more because half of the bladder is filled with a tumor, let's say. So getting a good evaluation of your pet, having blood work done on x-rays is so vital, because we could rule out some things, or if we find out that there's something wrong, we could manage them. And then also, if we find out that their kidneys are good, that's another disease. Kidney disease can make them drink a lot too. But anyway, so if we find out that their kidneys are good, that their adrenals are okay, that they don't have diabetes or any other disease that could cause them to drink and urinate a lot, then we could focus on just the other causes. So like I said, either some lumbar problems in their spine, or some hormone responsive problems. So there are medication that we could give, especially with those female dogs that are older that have urinary incontinence. It's a teeny weeny pill, and not very expensive, and that has been very successful to help those urinary incontinence dogs. So I would definitely first suggest going to see your veterinarian. Now, let's just say your pet is diagnosed with Cushing's, right? So as Edward and myself have dealt with dogs with Cushing's, you are going to have a dog that does drink a lot. And actually, you know what? There's also some medications that can make your dog drink a lot more. So if your dog has to be on steroids as an anti-inflammatory, or has to be on steroids because of cancer treatment, they will drink a lot more too. So we might be giving them medications that's making them drink more, but we need to give them that medication. Also with my dog Duncan, my Doberman, he had heart failure, and so I had to give him Lasix, which made him pee a lot too. And so he was a 110-pound Doberman. So you want to talk about a pool of urine that I came home to? I came home to a lot. So Rich has mentioned degenerative myelopathy. Yeah, so that's another neurological disorder that is just so debilitating, and it's also affects the spinal cord, and so they just don't have the neurological function of their sphincters. So there's a great number of causes for it. So that's why I really encourage you to go see your veterinarian. So many of us struggle with taking our pets to the vet when they're older, but a lot can be done, and at least just educated on what you're dealing with, right? So now what can you do around the home? And I've come to you with a ton of experience because, like I said, I had a 110-pound Doberman that had heart failure and 2 other dogs that had Cushing's. So I know what it's like to come home, you take off your shoes, and you step on the rug, and it's full of urine. So it is frustrating, and I am with you on understanding the frustration for it. So some suggestions I'll have, which might be a little silly sounding, but just bear with me. So there are some products, and I have a great helper that's going to put some links up there for you, but there's this one product called Snuggies, and it's like a diaper for dogs. And so there's a lot of inserts that you could put in here that will capture the urine. So this is one option. I had for my Samoyed, I'll post pictures later, but she had these. This is in like a hot pink version, and so the inserts I would actually just put in maxi pads as her inserts, and probably had to change it every hour almost because she urinated so much. And at the time, I lived in a house that had rug all over, so that was not conducive to cleaning easy. So there's a couple of different products out there that are like doggy diapers. There's another one called Pee Keeper, but I want you to be mindful of the gender of your dog to make sure that you get one that's properly fitted, because the boys and the girls are going to be a little bit different for obvious reasons, and so you want to make sure that you get something that can capture the urine appropriately. I want to discourage you from using like pull-em-ups or baby diapers, because the problem with those, and I have used them myself, where you cut a little dog a hole for their tail. The problem with those is that they contain a gel. So the gel is what the absorbent power is in diapers, and so once they fill up with urine, the gel kind of absorbs it. The problem with that is if a dog eats that gel, it can be obstructive and deadly, really. So I had a Samoyed who she could care less about her diaper, so I just used pull-em-ups. But I really want to discourage you, or just be very careful that if your dog has any interest in eating the diaper, that you don't use those. And I know you might think that's crazy. My dog would never eat a diaper. But you know dogs. They eat cat poop and various things along the street, dead birds and whatnot. So I don't put them past them of nibbling on some diapers. So anyway, there's different kind of doggy diapers. So again, just be careful of the size and of the gender that you're purchasing. Now, I'm sitting on my couch because I wanted to talk about your dog might be sleeping on the couch and have some urine dribble or just a complete expression of their bladder, and that's not comfortable for you to sit on then. So there are some really good couch covers to use, and I have a link to some couch covers. Just these are to give you ideas of what you can use. So you don't have to use the products I'm recommending, just to stimulate some great ideas. So definitely protecting your couch. Speaking of rugs and stepping on rugs are expensive and they're not easy to clean. So there's a wonderful new product out there called Ruggable, and we'll put up a link for that. And what it is there's different sizes of area rugs, and it's basically a rubber mat. And Joan, sorry, I love to read your comments, but then I get off track of what I'm saying, so I gotta focus. You're so sweet. Anyway, so these Ruggables are these rubbery mat things, and they've got this cover that looks like a really pretty rug. And all you have to do is remove the cover of it, so it's a thin cover, and so it's waterproof, and then you wash that, and that could fit in a regular washing machine, even though it's a large area rug, but then the rubber captures it, and so your floor stays safe. So I love the Ruggables. bath mats, and if your pet has one area that they keep going to the bathroom on, if they do have some control over where they're going, urinating on a bath mat with a thick rubber on the bottom is really helpful. So now there are the Weewee Pads out there. So if you guys know what I'm talking about, they're like the training pads, I don't know, 2x3 maybe or something like that. So those are great for small dogs that you can train on, but trying to put those little Weewee Pads on a dog bed, they just basically end up in a mush in the corner. At least that's what happened for me. So for my Duncan, for my Doberman, he had his dog bed that he loved to sleep on, but he would always pee on it. So then I was taking out the mattress and the bolster and washing it every single day, and that just had to stop. So I actually got a baby fitted mattress cover. So it's for baby mattresses, and it's a fitted sheet that has a waterproof lining on it. And so I got a couple of those, and so I would just put those on his dog beds. He had 2 dog beds, and then when he peed in the night, I just washed those. So that was super helpful for me. So we've got some options that are out there that you can do to help, that you could use to help protect your couch, your rug, the dog beds, things like that. Of course, making sure that somebody's there to let them out as much as possible. So with Duncan, he had to go out every 4 hours, and that was not easy. So we always had to work on our schedules so who could be home to let him out. But when they just urinate without even knowing about it, it can be a struggle. So I just want you guys to understand that I understand that in caregiver burden, especially with urinary continence, is hard. The number one reason why humans are sent to senior living facilities is because of incontinence. So I know that it's a struggle for when we're caring for humans and when we're caring for pets. So don't feel don't feel guilty about having this, be a struggle for you. But definitely, have some patience. Don't get frustrated with your pet because they want to be a good boy or girl. They know how to be a good girl or boy. They're geriatric. They've made it this far being good. They can't help it. So number one is absolutely go see your veterinarian to just rule out some of the common diseases that we see. And a lot of the treatments are not that difficult, especially a UTI if that is what the cause of it is. And then also, if you do find out that it's a neurological disease like degenerative myelopathy, we could also talk about some mobility things to help them around the house. So that just may be the first sign is having a urinary incontinent event, and then you find out that they've got something else that we can help them with. So go see your veterinarian just to kind of rule out some of these diseases and talk about options. And then there's a lot of other products. I'm always posting new products on my Amazon page, which I know that we posted a link to that. So when you guys send me ideas, I always post them, or I try to find them on Amazon, and I put them on my Amazon page. So that way other families that share the same struggles can also find these products. So there's also in my mobility talk, I Facebook Live, I had mentioned, and we'll put up a link again, for these dog beds that have a mesh bottom, if you will. So that way, if they are sleeping, most of the urine can fall through the mesh, and so that way they're not sleeping in the urine. And sometimes I had one time a client who had a beautiful German Shepherd that had degenerative myelopathy. So he was urinary and fecal incontinent. So we actually had to do a sanitary shave. So we shaved the lower half of his body. So his beautiful fur, we had to just say goodbye from ribs down. But he was so much more comfortable. And then we just used baby wipes to keep him clean. So big pile of baby wipes. And a trick to baby wipes, especially in our colder regions, is to get a baby wipe warmer, which you can get at any baby store. And it's a lot more comfortable to have that wiping down your dog than cold baby wipes. So I do hope this was helpful with urinary incontinence. Every month we do a Facebook Live. So if you have anything you want me to talk about, please do not hesitate to send us a message or put something in the comments. And if you guys start to write some questions or whatever, I'll certainly do my best to answer them or send you some information or direction where you can get some good information. So thank you to those that are watching and to my friends that are on here too. I really appreciate it. And my co-host has given up on his co-hosting. Oh boy. We'll see how he is next month. All right, take care. Bye.